Hi everyone, I am Dr. Vinayagamani, neurovascular interventional specialist at Madurai Hannah Joseph Hospital. So today we are going to talk about an important brain pathology, brain aneurysm. So what is brain aneurysm? Brain aneurysm is an abnormal bulge or a weak spot in the blood vessel which will cause gradual ballooning and one time it will burst like a time bomb. Why early diagnosis and awareness matter? Basically, the bulge will be asymptomatic. The balloon in the blood vessel is asymptomatic until it bursts. Once it bursts, it will cause immediate brain bleeding or brain hemorrhage, causing a massive stroke, or patient can go for coma or sometimes sudden death. So it is very important to diagnose it early. What are all the common symptoms of the brain aneurysm? The interesting point about the disease is, in most of the patients it will be asymptomatic. So the patient will not realize it unless they have a sudden severe headache. Apart from that, it can compress the adjacent nerves or brain and it can cause seizures, headache, vomiting, loss of consciousness and focal neurological deficit. So it is important to diagnose it early by various imaging methods. We have various imaging techniques recently with so many advanced imaging techniques. One of the best important imaging technique is DSA, digital subtraction angiogram. So we do angiography by putting a pinhole, small pinhole in the groin region or thigh, and we pass the catheter inside the brain vessel. We do inject contrast and we see whether how is the dye passing through the neurovascular system, and we will find the aneurysm. Once we find the asymptomatic aneurysm or symptomatic aneurysm, we do the risk stratification and then we'll do the treatment. All symptomatic aneurysm needs treatment. Asymptomatic aneurysms, we do risk stratification and we'll do the treatment. So now there are recent advancement in treatment of brain aneurysm. Traditionally, surgical clipping has been done over past 5 to 6 decades regularly, which is the safest approach. For the past 15 to 20 years, there is a steady peak in the development of advanced techniques in treating brain aneurysm. One of the technique is endovascular technique, where we approach through the pinhole in the groin like an angiogram treatment we call. So here we will be deploying a stent like mesh in the brain vessels. This is called flow diverter treatment. So the flow diverter stent is deployed across the weak spot or bulge in the vessel so that the blood flow is diverted from the aneurysm and it is directed towards the normal vessel. So over the time the aneurysm heals, it will shrink and the vessel gets normalized. So this is a treatment without open surgery. It's a minimal invasive surgery technique. So in this technology, we have a recent introduction of shield technology, which has reduced thrombogenicity and increased aneurysm occlusion rate. So if you have any symptoms like headache or any neurological symptoms, don't ignore, stay alert, stay aware. Brain aneurysm is very dangerous, potentially fatal, but early diagnosis and awareness, it can cause complete cure. So remember, there is a technology called flow diverter and shield technology. Let's divert to avert. Take care of your brain. Thank you.